Welcome to Facial Plastics Friday. Dr. Brace here, and today I wanted to address a topic that people often ask us about through email, through social media inquiries, and of course in consultation, and that's what will the scar look like, or where will the scar be if I do a facelift? And in our practice we do deep plane facelifts, and more often I'm doing a deep plane facelift with a preservation approach, which means minimal skin access, but the incision is pretty much the same. If you think about your face, if your cheek has dropped, your jawline has dropped, your neck has dropped, and we want to lift all that back up, you can just look at yourself and see where is the excess skin. It lands at your hairline and around your ear. Now, if you don't make an incision long enough, you'll end up with what we call a dog ear or a standing cone. So if you think about if you had a carpet and you cut a circle out in the middle of a carpet and you tried to sew it together, the ends would come up and it would create these dog ears. That's what happens in surgery when you lift things if the incision isn't long enough. So the answer to how long will my incision be is it depends on how much excess skin you have. If you have a lot of excess skin, the incision tends to have to be a little bit longer. If it's pretty minimal excess skin, it's a pretty minimal scar. But in general, it goes from along the hairline, we call this the temporal tuft, so along the temporal tuft, and usually at about the level of the eyebrow is where we aim to have it end, comes around up that temporal tuft in front of your ear, then down where your ear meets your cheek, and in behind your tragus if you're a woman, and in front of your tragus if you're a man. The reason for that difference is that if you have whiskers, we don't want to put them up onto your tragus so that you have to shave it. Once it comes down, it wraps around the earlobe, in the crease behind your ear, right back here, and then where your ear touches your hair, it comes across and then down your hairline. And like I said, if you have a lot of loose skin, that incision that goes down the hairline is going to be longer, whereas if you don't have a lot of hair or a lot of extra skin, that hairline incision will be shorter. And so that's what the incision looks like, or the design looks like. It heals really well. In almost everybody, it's a thin little white line that's hard to see. We hide it along the hairline here and here because I actually bevel it with the hair so that the hairs will grow through. Ideally, when you get to about the 1 year mark, you have hairs going through the incision. You can't really see it unless you're looking for it. There are instances where the scar doesn't heal well, where somebody that's prone to making thick scars or keloid scars or hypertrophic scars will need to have steroid injections, and sometimes will need to have the scar excised and redone. But in general, I'd say 98% of people, it's a barely visible scar. Now, all scars, as they heal, they flatten and they contract and they lose pigment. So the scar will end up white in almost all cases, but again, if it's hiding in creases and along hairlines, you won't really see that unless you're really looking for it. I hope that answers questions about facelift scars. If you have any questions outside of that, send them our way, and everybody have a great weekend.